walking away from a machine, and just all of a sudden, that's it, everything went blank.
One of our security officers was first on the scene. As soon as he got there, he called for help, and they called for an AED and the oxygen, which is our normal way of doing things when somebody goes down here.
He was out completely, he had no pulse, and he was just dying, and I picked him up, and there was no life to him at all. And so we immediately went and get the defibrillator and put it on, and we followed the props in the machine, and we brought him back.
It was almost as if he'd woken up, and I guess in the sense he had, but just was almost shocking.
Call came in, it was surveillance at the casino saying that they had a man that had arrested and staff on the floor was doing CPR. I asked them if they had an AED available, and they said they had already shocked him once.
We arrived in front of this patient, and I was anticipating a patient who was not going to be talking to us, was CPR and everything else in process, whereas they had done an excellent job of screening off this patient. There were screens up there, so it was pretty private actually for a casino setting, and this gentleman was opening his eyes and talking to us.
The casino staff had given us a complete report as we were coming in, and we continued to assess the patient. They reported that he had collapsed and indeed had received one shock from their AED. On my assessment, the patient was alert now and breathing.
And the next thing I remember, they were putting me in an ambulance outside the casino on a stretcher, and I thought I was having a bad dream.
And then in the back of the ambulance, I do remember sort of looking around thinking, wow, this guy for sure was in a shockable rhythm with the AED, and he's complete, minutes later, he's completely come around.
In this case, the chain of survival worked flawlessly. The skill of the casino staff was top-notch. They did a fabulous job recognizing the emergency, applying their AED.
It's very satisfactory to know that we helped save this guy's life. As a team, it was very satisfactory because some of these people, it was their first time ever in doing this, so obviously the training paid off.
It's very satisfying when you can go that extra step and perform with the AED on somebody and not have to wait for the fire department to get there with theirs, knowing that time is critical.
The research that Heart and Stroke provides to us talks about for every minute that passes, the efficacy of defibrillation drops by 10%. So when you're talking 5 minutes, which is a pretty fast first responder or EMS arrival, then we're talking about only a 50% chance compared to having a situation like this where the AED was in the casino and they're defibrillating within a minute or two. You're talking about an 80% chance of successful defibrillation. So it makes a huge difference.
When we're talking about cardiac arrest, time is muscle, meaning heart muscle, and the quicker that they can deploy these things, the better the results, the better outcomes these patients have.